how do I determine when like a behavior is unsafe or when it's just something that's just annoying? What should I be concerned about?
Yeah, I'll give you a broad answer to the question, that maybe that might elicit more back and forth here. But when we think about, and of course in the context of memory, loss of independence, one of the things that we can identify about what characterizes folks who have their immediate environment, a support system that is conducive to preservation of brain health, is one in which independence is not hampered. And that can be very tricky, because I always point to the converse, that folks who have their independence infringed upon really early on, it can lead to greater changes in terms of their mental health. And of course, that's going to have a big impact into how
Like, give me an example.
So for example, independence in terms of, it's tricky with driving, but I'll bring that up with driving, because it's a big one. There's a gradient of concern, so to speak, where one may notice changes early on, but it's hard to say at what point the concerns really represent some actual risk of potential danger or harm to oneself or other people. On the one hand, there's an approach where folks say, I already noticed some changes, I think it's time for me to take the keys away, and it can be more of a unilateral decision rather than one that takes into account a concern for somebody's the natural desire to be independent. So we usually approach it in a multi-pronged way. It requires raising everyone's perception of the problem to the same level, actually frequently getting objective evidence about one's ability to drive, and then making this the ultimate decision. So it's hard. In this case, we acknowledge that there is a gradient of concern about a particular behavior, and so we try to tease it apart as best as we can, make sure that everyone is on the same page about the concern, the level of function, and then try to obtain the same level of, try to obtain objective evidence of an impairment. The other thing that we like to point out to folks is that just focusing a lot and having discussions about changes in memory, bringing up to the affected person that they're forgetting a lot of things, that they forgot to start the coffee machine early in the morning, or they left the water running. That can be also damaging to the person.
Right. That just makes them mad.
Right.
That you're
exactly.
like picking on them and you're talking them. You're pointing out everything they're doing wrong.
Exactly. And that is, there are approaches that can still bring that to the forefront, but again, they're still respecting the individual's autonomy, and they're acknowledging their struggle, because we see it from one perspective, but the individual who is experiencing these changes, it's a lot. So
what is a way, so if you're seeing these, instead of saying, Mom, you did this again, or you left that stove on, what are some ways to talk about that without feeling like you're attacking them?
Well, one way, there ought to be some sort of spaces where these concerns can be visited every now and then. I think being proactive about offering reminders or really encouraging use of calendars in such a way that one frames it as enhancing efficiency, unloading the mental load of having to remember all of these things, and helping to establish routine. I think all of these things help the changes that somebody has been having, without having to necessarily point to folks that these are changes. Like, you're going straight to a potential solution that can help folks continue to remain independent for a little bit longer.
So helping them find, without making a big deal about it, find tools and routines and things to help support them.
Precisely.